My name is Andrew Siegel. I'm a physician based in the New York metropolitan area, and today I would like to discuss what I consider to be a very important subject: screening for prostate cancer. Now, as far as screening for prostate cancer, this year, 2009, there were two controversial studies published in the New England Journal of Medicine. Andriol reported no mortality benefit from combined rectal exam and PSA after 7 to 10 years. And Schroeder reported that the PSA screening alone, without the digital rectal examination, resulted in a 20% decrease in the death rate at follow-up of 9 years. That was the European study. Andriol was the American study. It is the consensus of many urologists, including myself, these studies were published prematurely with ambiguous results. Here are the hard facts. 95% of urologists and 80% of primary care doctors above the age of 50 have PSA testing done on themselves. Fact, the USA death rate from prostate cancer has fallen 4% a year since 1992, 5 years after PSA testing was introduced. Fact, many urologists do not screen or treat men who have a life expectancy less than 10 years because prostate cancer rarely causes mortality in the first decade after diagnosis, and other competing medical issues will cause death before the prostate cancer has a chance to. Fact, in general, prostate cancer is a slow-growing process, and early detection and treatment is directed at extending life well beyond the decade, well beyond the 10 years following diagnosis. And finally, these two studies will not prove meaningful until carried out for 15, 20, 25 years and beyond, the time reference in which we expect treatment to make a meaningful difference. When to stop screening for prostate cancer? This is a very controversial subject. The U.S. Preventive Services Task Force states the harms of screening outweigh the benefits in men above 75 years of age. And it is a fact that if at age 75, if you have a PSA that's less than 3, the chances of high-risk prostate cancer are minimal. My opinion, all 75-year-olds are not the same. Functional age trumps chronological age, and an individual's preference regarding screening is of great importance. Preventing prostate cancer. Healthy diet and regular exercise. There is no question about the fact that a Western diet high in meats, dairy, saturated fats, and lack of exercise can promote many cancers, including prostate cancer. Here's a fact. There are precursor lesions known as high-grade prostate intraepithelial neoplasia, HGPIN, many years before the onset of prostate cancer. Additionally, the increasing prevalence of cancer with aging. These facts taken in combination suggest that the process of cancer development occurs over a protracted interval. So essentially, there are many years from the initial mutation to the time when the cancer becomes clinically manifest with a PSA elevation or an abnormal digital rectal examination. In theory, this provides the opportunity for intervention before the establishment of a cancer. So what do we have on the market? We have finasteride, also known as Proscar and Propecia, and we also have dutasteride, also known as Avodart. These medications that were originally conceived for benign enlargement of the prostate, Propecia specifically for male pattern hair loss, clearly studies have proven that they decrease the incidence of prostate cancer. In addition to shrinking the prostate gland, in addition to potentially improving symptoms of prostate obstruction, they also lower the PSA by 50%, and they grow hair on the scalp. Have to admit it, I've been on Propecia for probably 10 years. It's finasteride, 1 milligram a day, filled my thinning crown in completely. And when the news reports came out about the prostate cancer prevention, it was simply a no-brainer. Following slides just show the success in terms of hair regrowth. Finally, I want to end with a quote or two from Willett Whitmore, MD. He was the head of urological oncology at Memorial Sloan Kettering Cancer Center for many years. He was a urologist who, in fact, ultimately succumbed to prostate cancer. First start of the quote: appropriate treatment for prostate cancer implies that therapy be applied neither to those patients for whom it is unnecessary nor to those for whom it will prove ineffective. Furthermore, the therapy should be that which will most assuredly permit the individual a qualitatively and quantitatively normal life. It needs not necessarily involve an effort at cancer cure. Human nature in physicians, be they surgeons, radiotherapists, or medical oncologists, is apt to attribute good results following treatment to such treatment, and bad results to the cancer, ignoring what is sometimes the equally plausible possibility that the good results are as much a consequence of the natural history of the tumor as are the bad results. Thank you for your attention. For more information, you can go to our website at bergenurological.com. You can download a free copy of Prostate Cancer Second Opinion that I authored. You may also find information on health and fitness on the website findyourfountainofyouth.com, where if you would like, you can download a free electronic copy of my book on health, wellness, fitness, and longevity. Thank you.